Hi everyone. In this video we will see about the history of ICD codes and what is the use of ICD codes and how do we pick an ICD code from the ICD textbook. The ICD codes were originally introduced by the WHO to list the cause of death. So that is how they started using these ICD codes. So they just wanted to list the diseases which led to death of the patient. So they classified all the diseases and put them under a list, and that is being used as ICD codes. But later it was further revised by different organizations and different countries, and at present we are using ICD 10 CM. This is published by the CMS and WHO and also this NCHS. All of them together has formulated some guidelines how to use these ICD codes, and every year they give us a revised guideline, and at present we are using ICD 10th revision clinical modification. Actually, WHO has got a set of codes for diseases that is called ICD 10, but this ICD 10 CM is specifically prepared by the US Medical Department to use this code widely for all kind of diagnosis. And there is another set of ICD codes that most of you will not be knowing, that is ICD 10 PCS. That will be used only for inpatient admissions. In a hospital, if a patient is getting admitted for some treatment, we use ICD 10 PCS codes. But for the diagnosis, we always use ICD 10 CM codes, whatever it is. It can be an inpatient or an outpatient, but for diagnosis, we always use ICD 10 CM codes. So now let us see about how these ICD codes are formulated or designed, and how do we use that for diagnosis. What is the criteria for selecting the ICD codes, and how to use this ICD textbook to pick a code, and what are the general guidelines that will be followed whenever we are using these ICD codes. First thing, you should remember that we use ICD 10 CM codes only for diagnosis. Diagnosis means when a patient is coming to the hospital, first the doctor will try to identify what is the disease the patient is having. To find it out, he will do a physical examination, he will do some labs testing, he will do some x-ray studies, and all those things will finally let him find what is the problem patient is having. So that will be called as the final diagnosis. So mainly we use ICD codes for diagnosis, and mostly it should be a confirmed diagnosis. And how does an ICD code look like? It is an alphanumerical code. That means it contains alphabets and also numbers. ICD codes have full set of alphabets, like from letter A till letter Z we have codes in this ICD textbook. And each and every letter belongs to a particular topic. For example, if it is an A series of codes, if the codes are starting with A, it says that it is always from infectious diseases. So if you are trying to find a code for diseases caused by infections like bacterial, virus or fungi infections, you have to always check this letter A series. Even B series also belongs to infections. Like that, they have categorized the codes in this ICD textbook. So A means it always belongs to infections. Next is, after the alphabet, you will be finding some numbers in the ICD codes. And an ICD code will be having minimum of 3 characters, maximum of 7 characters. Minimum 3, maximum 7. And if a code has got only 3 characters, that is called as a category code. And if the code has got more characters, that means 4 characters, 5 characters, 6 characters and 7 characters and all, we call them as subcategory codes. And whenever you see a subcategory code, there will be a dot after the 3rd character. So that is how we identify the ICD codes. Minimum 3 characters, maximum 7 characters, and if the code is extended more than 3 characters, you will always find a dot after the 3rd character. And even sometimes after the 3rd character, it can be alphabets or numbers. It depends upon the type of disease or the problem the patient is having. And if you add more characters to the code, that will be more specific to the disease. So that is the purpose of giving more characters. So if you want high specificity, always prefer to report with more characters in ICD codes. And also you should note one more point. The ICD book is divided into two volumes, volume 1 and volume 2. In volume 1, you will find all the tabular list of diseases and injuries. That means it includes all the 22 chapters that are arranged according to the diseases, how we code it. And also you can see all the A to Z series of codes there. In the second volume of ICD textbook, you will find the alphabetic index and also index of diseases and injuries, index of external causes of injuries, table of neoplasms, and table of drugs and chemicals. Actually, ICD book is given as just one book, but we can divide it into two volumes. Volume 1 contains all the chapter-wise codes are tabular list of diseases and injuries, and all the other things will belong to volume 2 of the ICD book. Keep that in mind, because sometimes in the exam they will ask you what is there in volume 1 of ICD textbook or what is there in volume 2 of ICD textbook. So now we'll move on to the general guidelines that has to be followed when you are reporting an ICD code. That is there in your ICD textbook at the initial pages. Page number will be given as G1, G2 like that. There you can find all the general guidelines and as well the chapter specific guidelines. Okay, so first guideline is whenever you are checking a code in ICD book, what you have to do is you have to check the alphabetic index in the ICD textbook, and followed by that you should check the tabular list to confirm the code. Alphabetic index is just like a dictionary where you can find all the diseases according to their alphabetical order, and there will be a code given adjacent to that. But you have to always confirm the code by checking the tabular list. So now I'll show you how to do that. Okay, now I have taken this alphabetic index. In the textbook it is given as ICD 10CM Index to Diseases and Injuries. So under this you can find all the diseases are arranged according to their alphabetical order, and just next to them you will be finding the codes also. And sometimes below the disease you will be finding some classification, like under the disease itself, if it is further classified you will be finding more specific codes. So for example, now if I say that I want to find a code for a disease anemia, first I'll be picking up the word anemia. So now I'll show you, after I'm picking up the word anemia, how I'm going to choose the code. Yes, so now I have taken the word anemia, and after anemia I can find so many other terms within the bracket. Here you can see essential, general anemia, or hemoglobin deficiency, or infantile anemia, primary anemia, or profound anemia. That is all given with the same code D64.9. So first thing, if I want to check a code for anemia without any further information, I will check this code D64.9. But if there is some specific type of anemia that is mentioned, I can find the code based on that. For example, I say that my patient has got pernicious anemia. For pernicious anemia, I should check the code D51.0. So now I'll show you how we are going to pick these codes from the tabular list. Now we'll look for this code D64.9. So you can check the index. There you can find this in chapter 3, diseases of blood and blood forming organs and disorders involving immune mechanism. There we can find the codes D50 to D89. So now I'm just going into that. There the first code is D50, that is used for iron deficiency anemia. So if the doctor has specified it as iron deficiency anemia, I can pick this code, but the doctor has not specified the type of anemia. So doctor has just mentioned that patient has got anemia. So I'll be going to the code D64.9. So now we will see that code. What does it say? Yes, so now we have reached this code D64.9 that says that it is used for unspecified anemia. That means the specific type of anemia is not mentioned. It is not specified. The doctor has just mentioned that patient has got anemia. No more specification has been given. In such a scenario, we can use this code D64.9. But just above this D64.9, we can see so many other codes for different types of anemias. Now, for example, I say that My doctor's report says that my patient has got a specific type of anemia which is called as hereditary sideroblastic anemia. Then I should be reporting the code D64.0. So this is the basic way of checking the codes in ICD textbook. So just go through the medical report, what all things are there in the medical report, what all diseases are mentioned, and check for more specificity. If there is no specification, you can pick the unspecified code, and if there is specification, we pick the more specified code. So this is the basic idea of finding a code in ICD textbook. We'll move to the next guideline. Yeah, the next guideline says that it's about the format and the structure of the ICD codes. Already I've told you, ICD codes are alpha numerical codes that starts with an alphabet always, and after the alphabet you will be finding numbers, or sometimes you will find alphabets also. And the minimum character in ICD code will be 3 characters, maximum characters will be 7 characters. So it can be in between any of these 3 to 7. It can be a 4-character code, 5-character code, 6-character code, depending upon the classification of the disease. So you can see here, the ICD codes are divided as categories and subcategories. So that is what is given in this paragraph. You can see that. And sometimes the subcategory can have only 4 to 5 characters, or subcategory code can have 7 characters, up to 7 characters also. It depends upon the condition or the disease which we are coding for. And if you need more characters, you have to add more characters to the ICD codes. That is very important. And if the code specifies that you need additional character, you have to give that. For example, before the code you will find a circle, and within the circle you will find some number like 4th, 5th, 6th, like that. That says that you need 4th character for this particular code to be reported, 5th character for this code to be reported, and like that until 7th character they will give. And also sometimes you will find the 7th character circle in blue color. If you see such a blue circle with 7th character, that says that you need placeholder in front of the 7th character. So you will see that the code will be having only 5 characters or 4 characters, but it has to be extended with a 7th character. So you don't have 4th, 5th or 6th characters. So in their place, you have to give a placeholder. So we will see some examples for that also. Here you can see the code E08.37 that has got only 5 characters, but before that there is a circle and it states that 7th character is needed. And you can see that the circle is in blue color. So remember that you have to add a placeholder before the 7th character. So now how we are going to report this code with the 7th character. The code is E08.37, where the 7th character can be 0, 1, 2 or 3. So here I will add the 7th character after adding letter X in front of the 7th character. For example, E08.37X1 or E08.37X2. Like that we have to report this code. Okay, now let us move to the next guideline. The next guideline says that use of codes for reporting purposes. For reporting purposes only codes are permissible, not categories or subcategories, and any applicable 7th character is required. So you have to report the codes with maximum number of characters that is needed. Now take the 4th guideline that says about the placeholder. Already under the 7th character, I told you if there is no 5th or 6th character, you have to report the code with letter X in the place of 5th and 6th characters to extend the code up to 7 characters. So we are just placing letter X there to increase the length of the code. Otherwise, there is no use of this placeholder. Placeholder doesn't have any value or importance. Just to add the 7th character, we are reporting the code with placeholder X in the place of 5th or 6th characters. So it depends upon the number of total characters the code has got. So you have to always check for that. If you see a circle in blue color with 7th written in it, it's very clear that you have to report the code with placeholders. So don't forget this point. Next guideline is about the 7th characters itself. So you have to always check before the code. If there is any additional character, you have to always report that.
And if the code specifically says that it needs a seventh character, you have to promptly give that. It can be sometimes an alphabet or it can be sometimes a number. It depends upon the condition that is to be coded. For example, under fractures and all, we use seventh character as letters. Letter A, letter D, letter S. Like that, we have so many letters there. And if it is related to laterality or side, we will use 0, 1, 2, 3. So you have to always report the code with maximum number of characters, and if seventh character is needed, that is to be given for sure. And the next guideline is about some abbreviations that are used in this ICD textbook. You will find two abbreviations very commonly in the ICD textbook. First abbreviation is NEC and the second abbreviation is NOS. First let us see about NEC. So what does NEC mean? NEC means not elsewhere classifiable. Not elsewhere classifiable. And this abbreviation in the alphabetic index will be represented as other specified. Other specified. That means sometimes you will not be finding a specific code for a specific condition in the ICD textbook.
In such a situation, we can use this other specified code. That means that the condition is otherwise specified, but there is no specific code for that particular condition. So it is specified, but the specificity is not there in the textbook. So we are picking up another specified code. So for example, you can check this code E03.8 that is used for other specified hypothyroidism. That means the type of hypothyroidism is mentioned in the report, but that particular type is not having a code in the ICD textbook. That is not found in the textbook. So you can use this code E03.8. So this is an example for not elsewhere classifiable diseases or codes. Next we'll move to not otherwise specified codes. So if you see this NOS, that means that the condition is not otherwise specified. They have just given the name of the disease, but the doctor has not specified any subclassification or subtype of the disease. In such a case, you can use unspecified codes. So if you find these words not otherwise specified in the alphabetic index, you can use unspecified codes. So always remember that unspecified codes means the disease which is not specified, which is not further specified, will be reported with unspecified codes. Now I'll show you one example also. For example, you can see this code E03.9, which is used for hypothyroidism unspecified or myxedema not otherwise specified, can be coded as E03.9. So that says that the type of hypothyroidism is not specifically given. So we are reporting that with the help of unspecified code. So the disease which is not elsewhere classifiable will be reported with other specified codes, and the disease which is to be said as not otherwise specified will be coded with the help of unspecified codes. So these two abbreviations are very important in the ICD textbook. The next guideline is about the punctuations that are used in the ICD textbook. The first punctuation is square brackets. If you find square brackets in the tabular list, that will include synonyms, alternative wordings, or explanation terms will be there. And if it is found in the alphabetic index, that is used to identify manifestation codes. So we will see what is this manifestation later. So if you find square brackets in tabular list, remember that it will include synonyms, alternative wordings, or explanation words for the diseases. So now I'll give you some example for that. You can see here the code A50.4 says that it is used for late congenital neurosyphilis, and after the code you can see juvenile neurosyphilis within the square bracket. So if you ever see a square bracket, it can be a synonym or other meaning for the disease only. So if the patient's medical report says that patient has got a juvenile neurosyphilis, then also you can report the same code. So that is the meaning of this square bracket. Next is about the normal brackets or parentheses. Parentheses are both used in alphabetic index and tabular list as well. And the words that are given within the parenthesis is called as non-essential modifiers. That means
those words will not affect your coding in any way.
So whenever you see some words within the parentheses or brackets, that will not affect your coding in any way. Now I'll show you one example in the alphabetic index. Absence of an organ or a part of, within the bracket you can see it can be complete or a partial. So everything is given within the bracket only, and it can be adrenal gland, congenital. All these can be reported with a single code Q89.1. So like that, there are many things. You can see this normal parenthesis in so many places in the alphabetic index. Now we'll check one more example for this parenthesis in tabular index. So now I've shown you a code A49.02 that is used for methicillin resistant Staph aureus infection. And in the next line you can find that it is methicillin resistant Staph aureus. Within bracket or parenthesis you can find MRSA. So it is the same thing only. Nothing will change here. It is all coded with the same code. Then you find the next punctuation, that is the colon symbol. When you find colon in tabular list, you should understand that the term is incomplete. It needs some or more additional terms to be added to it to make it as an assignable given category. So that is the meaning of colon symbol. That means it is incomplete. You have to complete it with adding some more words or modifiers to it. Okay. Next guideline is about the word and. So we all know what is the meaning of word and, but the description is not given. It will be given little later. So now we can move to the next guideline, number 9. That is again used for other and unspecified codes. Already we have seen this under the abbreviation NEC and NOS. For diseases which are not elsewhere classifiable, we use other specified codes, and for diseases which are not otherwise specified, we use the codes unspecified. So that is the difference between NEC and NOS or other and unspecified codes. Next is about includes notes. Below some diseases you will find this includes notes. So that says that that particular code includes all these diseases also. So this note appears immediately under a 3-character code title to further define or give examples of the content of the same category. Now I'll give you one example for that. So when you check this code E10 type 1 diabetes mellitus, below that you can find it includes brittle diabetes mellitus due to autoimmune process, diabetes mellitus due to immune mediated pancreatic islet beta cell destruction, idiopathic diabetic mellitus, juvenile onset diabetes mellitus, ketosis prone diabetes mellitus. All these can be coded as E10, that is type 1 diabetes mellitus. So this is the meaning of includes notes. Now we'll move to inclusion terms. List of terms that is included under some codes. These terms are the conditions for which that code is to be used. The terms may be synonymous of the code title, or in case of other specified codes, the terms are a list of various conditions assigned to that code. The inclusion terms are not necessarily exhaustive. Additional terms found only in the alphabetic index may also be assigned to a code. So inclusion terms are nothing but synonym of the name of the same disease only. So we will find some example for that too. Here I have taken the code A01.02, which is used for typhoid fever with heart involvement. That can also be said as typhoid endocarditis or typhoid myocarditis. Endocarditis and myocarditis are diseases which affects the heart. So we can use A01.02 if there is a heart involvement due to typhoid. So for all these conditions, we can report this A01.02. So that is all about inclusion terms. Next is very important guideline, that is the excludes notes. Excludes notes will appear under some category codes, and it is classified into excludes 1 and excludes 2 notes. Excludes 1 will be given in a dark black color, and excludes 2 notes will be given in a gray color. So with that you can identify whether it is excludes 1 or excludes 2. And if you find excludes 1 notes under any code, it says that the particular diseases which are given under this excludes 1 should never be reported with a code above this. So you can never code these diseases together which are given under excludes 1. That is the important thing you have to follow. So when something is found under excludes 1, don't report it together with the previous code. That is the thing you have to understand. Now I'll give you some example for that. If you check this code E10, that is type 1 diabetes mellitus, below that you can find excludes 1 notes. So you should not report this code E10 with the diseases that are mentioned under excludes 1. For example, you can never report E08 or E09 or O24.4 with E10 series of codes, because both of these conditions can never exist together in a patient. That is not a possibility at all. In such cases only they will give this excludes 1. So if you find an excludes 1 notes, you should remember that strictly no. You can never code those diseases together. One more example you can see here. Type 2 diabetes, that is E11, that can never be coded with E10 because type 2 and type 1 diabetes cannot exist together. So whenever you see excludes 1 notes, you should be very much alert. Now we'll move on to excludes 2 notes. Whenever you see this excludes 2 notes, that means these two diseases cannot exist together, but rarely they can exist together. So what you can do is, if doctor has given both these diseases which are given under excludes 2, then you can query or verify with the doctor whether both the conditions are present in the patient or not. So whenever you find excludes 2, you can report those diseases together because there is a rare chance of those diseases existing together. That is the meaning of excludes 2. So excludes 2 can be reported together. Here I am showing one example. Infection specific to the perinatal period. Perinatal means around the time of birth. When a baby is delivered, around the next 28 days, if the baby is getting some infection, that is called as perinatal infection. Below that you can find that excludes 2 notes. It says about so many infections like congenital gonococcal infection, congenital pneumonia, congenital syphilis, like that. So all these conditions can be present in a child along with the perinatal condition. So that means you can code infections that are present during the perinatal period with all the diseases that are mentioned under this excludes 2 if both are existing together. So that is all about excludes 1 and excludes 2 notes. Next we'll move on to etiology and manifestation convention. First, let us see what is etiology. Etiology means that is the cause or a causative thing which is leading to something else. And manifestation means it is caused by the etiology. So manifestation is something secondary to the primary etiology. So etiology is the primary condition. Manifestation will occur as an effect of an etiology. So it can be something like a sign or a symptom or which develops after the etiology. So always you will check whether the condition is an etiology or a manifestation. If it is an etiology, report it as a primary code. And if it is a manifestation, report it as a secondary code. And how are you going to identify this is an etiology or this is a manifestation? For some diseases, we know about etiology and manifestations. But for some diseases, we will not know that. So in such a case, how we can find it out? We can find it with the help of some nodes under the codes. The first node can be code first note. The second note will be code also or use additional code notes. And the last thing would be sometimes in the code description itself they will use the term in diseases classified elsewhere. So all these terms will help you to identify whether the code is an etiology or manifestation. Now we will check some examples and with the help of that I'll explain whether it is an etiology or a manifestation. Yes. So now if we check this code B20, below that you can find use additional code note, and it says that you can use additional codes to identify all manifestations of HIV infection. So here HIV is the etiology. All the manifestations that are caused by HIV will be reported as secondary codes. So here HIV is the etiology. And additionally, we report secondary codes for all the manifestations of HIV. This is one example. We'll move to the next example, that is A40, which is used for streptococcal sepsis. And below that, you can find code first note in red color with a pointing finger symbol. And that says that you have to always report what is the cause of this streptococcal sepsis first before this code A40. For example, I say that my patient has got streptococcal sepsis due to a central venous catheter. I have to report T80.211 series of codes as primary code, and I can report A40 as a secondary code. So always remember that whatever is the etiology, that will be reported as a primary code, and whatever is a manifestation, that will be reported as a secondary code. So if you ever see a code first note under a code, that particular code will be a manifestation code. And if you ever see use additional code note below a code, that says that it is an etiology code. And one more thing that will help you to identify whether the code is an etiology or manifestation is the terms diseases classified elsewhere. For example, you can see here the code F02 that says that dementia in other diseases classified elsewhere. So here dementia is a problem, but that is caused by something else. So that has to be reported as the primary code. So that is given under code first notes. So you can see the pointing finger, and also you can see the code first note in red color. So that code should be reported before F02. And remember that when the code uses this word other diseases classified elsewhere, you cannot report it as a primary code, or you cannot report it as a single code. Always it has to be paired with the etiology code. For example, I will always report F02 with any of these codes that is given here, G30, and then I can report F02 if patient has got Alzheimer's disease and dementia together, or if patient has got epilepsy and recurrent seizures and dementia, I will report G40 and F02 together. So these are the ways to identify whether the code is an etiology or manifestation. You can identify with the help of these terms, use additional code note, code first note, and in diseases classified elsewhere terms. So I hope this video will be helpful to you in learning general guidelines regarding ICD, and I will continue with this because there are still more guidelines, and please don't forget to subscribe to my channel for more videos on CPT and ICD guidelines. Thank you.